Good morning, and thank you for joining us this morning for this short webinar which will provide practical advice about how to choose a care home in these very strange times that we're living in. We have financial, legal and home move experts ready to take any questions you may have in the chat box, as well as our own care advisors from Autumna. But if you'd rather concentrate on the webinar and then ask questions later, all their contact details are in the description below. Families still need to find care homes for their loved ones, but with current restrictions on visiting, finding the right one for your particular needs is not quite as simple as it might have been in the past. My name is Debbie Harris and I'm the Managing Director of Autumna, an online directory of every registered care provider in the UK. And I've broken this webinar down into 4 key points, some of which are relevant whenever you're choosing a care home, and some that reflect the very specific times we find ourselves in, not just during the pandemic, but actually as I speak in lockdown. The first point we'll address the key questions you need to have asked yourself before you begin any research. Then in point 2, we'll talk about the safety of care homes during the pandemic. Thirdly, we'll talk about the logistics of moving into a care home, the quarantine restrictions, and what activities you can expect to be involved in once you've moved in. And then we'll cover visiting and the different ways families can stay connected. So let's begin with the first point, the key questions you need to have asked yourself before you begin any research. Now, these are going to sound a bit obvious, but many people in the heat of the moment can miss them, so I really wanted to flag these up to you. The key questions: 1. Where should I be looking? The geographical location of the home is really important. This needs to be close to the person most likely to visit. Try not to fall into the trap of looking for a home in the area your relative has always lived. If you're the person most likely to visit, make sure it's near you. Number 2, you need to know the type of care home you're looking for. You may need an assessment or to call our advice line to help you with this. You need to know whether you're looking for residential or nursing care, and also what level of dementia care, if any, you need. And the final 2 points are to do with legal and financial implications. How much can you afford? We would always recommend getting advice on this. And we have Nikki Cave from Elder Care with us. Nikki, what is the most common thing you see?
So the people we talk to generally have no idea how the system works. This is the first time they've dealt with this. So there's a lot of misinformation out there. And of course, people don't know what they don't know. So it's really about just taking them through, holding their hand through how the system works, making sure that even as a self-funder, they know their estate benefits that they might be able to claim. They don't have to rush to sell the house. There's a scheme available that actually means if they wanted to rent it out, they could take that route and borrow what they need from the local authority. So we'll make sure they understand how that all works. Families are also really concerned about money running out if someone's staying care is a long one. So we'll also introduce the idea of a policy called a care fees annuity. It's not for everyone, of course, but it's something that most people just don't know about and actually can provide a great deal of peace of mind. So that's really, in a nutshell, what our advice is about. It's dispelling myths and making sure people are informed.
Thanks, Nikki. Nikki, by the way, is on the chat line right now if you have any questions. And so too is Amanda Attrell from Parfitt Cresswell, who can tell you briefly why legal advice is so important when considering residential care.
It's important to consider who you would want to help you manage your affairs if you need assistance in the future. Unless you plan ahead, if you lose capacity, an application to the Court of Protection would be needed, and this process is costly and it can take up to 12 months. It's much better to plan in advance by making a document called a lasting power of attorney. There's the financial lasting power of attorney, which allows you to appoint people that you trust to manage your finances for you. And there's a health and welfare lasting power of attorney, which allows you to choose people who can make decisions such as where you live, the type of medical treatment you receive, and the type of care as well. Most people assume that your family or your next of kin will have this authority, but that isn't the case.
Thanks, Amanda. So now, on to point 2, where we'll focus on the pandemic-related issues. The question our advice line is getting all the time at the moment is, are care homes safe? It's not surprising, following various media reports at the start of the pandemic in March and April. But what is the situation now? I want to give you some statistics. There are approximately 420,000 people living in care homes in the UK. And from data provided by one of Autumna's partners, person-centred software, in the 2 weeks leading up to this webcast, it's estimated that 15,000 people have moved into residential care. So whether we're living in a pandemic or not, people still need care homes and the care and the social benefits that they can bring. But the fact is, care homes are familiar with preventing and controlling infections. Flu and norovirus are just 2 very common examples. However, COVID-19 has shone a spotlight on the procedures and the protocols we all follow, so it makes sense care homes are really clear about what they're doing. So, what are care homes doing to keep residents and staff safe? To begin with, government regulations state that staff are tested every week in a care home and residents should be tested every 4 weeks. Many care homes are testing more often than this. The CQC has increased its infection control and prevention testing, and it is in everybody's interests to be as stringent as possible with this virus, and some care homes have really gone the extra mile to keep the virus out. And this is just a small example. Virtual tours, so you can see what a care home is like without actually walking in through the front door. They're so accurate you can take exact measurements to see if your furniture will fit. Virtual visits. Many care homes are arranging virtual visits where a manager will walk you around with FaceTime or Zoom. Some of the other measures care homes are taking, way over and above government guidelines, are things like air filtration and purification equipment. There's clear evidence the virus is airborne, so they're responding to that. New sterilisation and disinfection devices, infection screening and monitoring technology. It's clear that the safety of residents and staff is paramount. In response to the many questions we were getting on our advice line about the safety of residential care, we introduced the S.A.F.E Infection Control Initiative. The aim of S.A.F.E is to help families looking for care to find exactly what the care homes are doing in terms of infection prevention and control. The fact is they've always done a lot, and now they're doing even more. So on to the third point. Having chosen a care home and reassured yourself it is safe, what are the logistics involved in moving in? What does quarantine look like? And crucially, what activities are going on in the care home, bearing in mind all of the restrictions? Because of course these will impact whether or not you choose that home or not. So let's deal with point 1, the logistics of actually moving into a care home at the moment. Suzanne from Your Home Move specialises in care home moves, and this is her view of how it works.
At the moment, moving people in the pandemic is providing a few challenges, but nothing that we haven't been able to overcome. When we're going into people's homes, helping them sort out all their possessions and working out what they want to take with them and what they want to do with the remainder, we go in, we've got full PPE, we wear gloves, we wear masks, we maintain a safe distance where possible. So we always keep the safety of our clients and of us at the forefront. When it comes to moving people into the homes themselves, what happens is we follow the same testing procedures for COVID as they do moving in, which are in line with a particular care home's procedures, whether that be tested for COVID 5 days before or whatever the requirements are. So then we are able to go in on moving day with our clients to help unpack, make the bed, and generally just settle them in to make sure that they feel at home from day one. Always make a cup of tea. I make a really good cup of tea. We all do. That's one of the primary requisites for moving day. Lots of tea, lots of help, just to make sure everything goes smoothly and everyone's settled without any stress whatsoever.
Thanks, Suzanne. And don't forget, Suzanne is available to answer any questions in the chat box, or of course you can find her details in the description below. So on to point 2. What does quarantine look like? Most care homes are asking for a negative COVID test before you move in, and then once you've moved in, you may still be required to isolate yourself from other residents for up to 14 days. But once again, some care homes are being really innovative and are allowing a relative to move in with you for those crucial first few weeks. Other homes have welcome suites. That's 2 rooms with an external door to the garden to allow protected visits. Care homes are doing whatever they can, depending often upon the limitations of their building. Every care home will be doing something different, so when you're talking to the homes, ask them, and I'm sure they'll be happy to tell you. Then thirdly, what is going on in care homes during the pandemic? I think this is important to consider if you're unsure whether or not a care home is the best option for your relative. If they were still at home, what would they be doing? Loneliness and depression has been well documented over the previous 7 months, and a care home with the activities, engagement and social interaction can be a great antidote to that. We've found that Facebook is an excellent way to see what is going on in care homes when it's difficult to visit, and we've integrated a live feed to Facebook on Autumna. So to point 4, our final point, and one which I know is uppermost in everybody's minds when they're considering a care home. And it's about visiting a relative once they've moved in and how you stay connected. Again, care homes are being inventive and investing heavily in maximising every opportunity to do this. But they are restricted by government and local authority guidelines, which, to be honest, are not too clear during the lockdown. The government announced 2 weeks ago that all care home residents could receive visits from their family and friends in a COVID-secure way through the use of social distancing and PPE. They also revealed a programme to enable specific family and friend visits supported by testing that they will trial later this month. Now, the guidance encouraged care homes, especially those who haven't allowed visits since March, to provide safe visiting opportunities, using innovations such as floor-to-ceiling screens, visiting pods and window visits. Many homes now have safe visiting spaces which allow relatives to meet without the risk of contamination. Care homes are doing whatever they can, depending upon the limitations of their building. Every care home will be doing something different, so you will need to ask them and they'll be happy to tell you. Care homes, alongside the National Care Forum, Age UK, John's Campaign and Autumna, have been lobbying to allow visits to continue, as we all recognise that they are vitally important. So, in conclusion, make sure you've asked yourself those key questions about what type of care home you're looking for before you begin your research. That's location, type of care you need, the price of the care and any legal issues. Reassure yourself about the infection control measures a care home is taking. What is the care home's quarantine procedure? And check out what the home is doing to make it a stimulating environment to live in. What are the visiting protocols? How far has the home gone to maximise safe visiting spaces in whatever way they can? I know this is a daunting time, and the pandemic adds to the guilt and trauma often felt when you need to choose a care home for a relative. If you need to talk to someone, Autumna operates a free advice line, and we're open 7 days a week, and you can speak to one of our friendly expert advisors. You can also use our online database to find a full list of all of the care providers in the UK and see what their infection prevention and control policies are. And you can find out about their safe visiting spaces. I'd like to thank you for joining us this morning, and I hope you found the talk useful. You'll find a lot of really useful links in the description below, but if in doubt, just give us a call. Thanks again for watching and have a good rest of the weekend.